Hi there. So in this session we will discuss about bundle branch blocks. But before understanding bundle branch blocks, we have to understand about something else, right? About the conducting system of the heart in brief. So we will first discuss about conducting system of the heart. Then we will see in where exactly you will locate your bundle branch blocks, and then we will discuss about the tracings. So first, let's discuss about the conducting system of the heart. So let's assume it to be your heart. You know this part is your atrium, this part is your ventricle. You can further divide into right atrium, left atrium, right ventricle, left ventricle. If this side is your right side, this is your left side. I hope I am clear. Talking about atrial waves, you know atrial depolarization as P wave and ventricular, mainly ventricular depolarization as your QRS waves. So ventricular abnormality will be shown in your QRS waves. So this is clear, correct? Now let's see how the conducting system usually runs. So here if I tell it is your SA node, AV node will be definitely between atria and ventricles because name is atrioventricular node. So there is your AV node. So the impulses will go from SA node to AV node. From AV node it will be like this, okay. Bundle of His via right bundle, left bundle, and then Purkinje fibers. So this is your bundle of His, then it will divide into right bundle branch, left bundle branch, and this is your Purkinje fibers, okay. So now if your this, oh my god, I will take another pen. If your this bundle branches gets blocked, that means your conducting system is halted. So with a halted conducting system, what can we expect? The changes in the ECG. Now see, till when your everything is normal, every conducting pathway is normal, the QRS is like this, and normal is 120 millisecond is your QRS, okay. So QRS 120 millisecond normally it was there, right? Now here the conducting system is halted, the pathway is the pathway has been pathway has been delayed, okay. So what changes you can expect in the QRS? Because previously the path was smooth, now there is a blockage in the path, so definitely the conducting system will take a longer time, so that will bring a change in your QRS. The QRS will become wide, narrow, wide and prolonged, okay. Previously when the road was smooth, the QRS was 120 millisecond. Now there is a blockage in the path, or there is a jam in the path. Now what will happen with the QRS? Definitely the conducting system, the impulse will take a longer time to reach to the Purkinje fibers, right? So the conducting this impulse will take a longer duration, right? So that means the QRS or the path has widened. I hope you are understanding the point. Previously the conducting pathway had no blockage, so it was smooth transmit of impulses, and it was 120 millisecond very fast. But now there is a blockage, and therefore the QRS has been delayed. And how much delayed? Of course it is more than 120 millisecond, and the moreover the QRS has become widened, right? Okay. Now what all leads we will look in case of right bundle branch or left bundle branch. So I will discuss in very short, very crisp manner, so that you have to remember as well, no? So say it is a human body, correct? This is your right side, this is your left side, your heart is on the left side. Now when I drew your bundle branch, you must remember that I drew, this is your right bundle branch, this is your left bundle branch. From the above figure I just drew your bundle branch of the heart. Somewhat it goes like this, right? Now just imagine when I am going to place your leads. Of course your first lead will be here, second will be on the left side. Illustration, right? Now this is your sternum, okay. Now when I will place your chest leads, how will I place it? I hope you remember, it goes somewhere like this, B1, B2, B3, is not it? B4, B5, B6. Just I am drawing this. This B1 to B6 goes this direction, right? So if I say in what chest leads you will expect the changes in right bundle branch block, definitely you can see from the diagram that B1, B2, this comes almost in the region of the right bundle branch, correct? No? And B5, B6, the extreme leads come in the direction of left bundle branch, particularly B4, B5, B6. So from this diagram you can see that the V1, V2 or lead 1 will show the changes of right bundle branch block, and the lead 2, B5, B4, B6, this all will show the changes of the left bundle branch block, is not it? Yeah, correct. So let's now come to this diagram. So here, and also I will like to say that when you will see changes, say in right bundle branch block, you are seeing the changes in the V1, B2. That means in the B5, B6 there will be reciprocal change. Often, not necessary. Often there will be reciprocal change. Similarly in the for the left bundle branch block. Now let's move on here. So here there, first one I will discuss about right bundle branch block. So right bundle branch block, of course the duration is more than 120 millisecond, widened QRS, all we have discussed. There is a wide R wave in V1. Now you first I will show you the pattern, what pattern you will get. So of course you can see that they are showing lead 1 and V1. Now you know the reason why lead 1, V1, because it is a right bundle branch block, and I showed you here, right, why it is so, why we are looking in lead 1 and V1. Always remember that in bundle branch block we will get some in QRS complex we will get something like M pattern. Remembering M pattern. Now M pattern, this is the condition of your QRS wave. Now usually QRS is like this, but in bundle branch block you will see something like this, M pattern, and they have named it, first peak as your R and next is your R dash. So any M pattern in your ECG, if it is in your first lead or V1, it is definitely bundle branch block, with bundle branch, right bundle branch. Now you know the reason. And if it is in a B5, B6, of course it is a left bundle branch. And when you will see, say in example of right bundle branch, you are seeing M pattern in 1 and V1, then often you will see a reciprocal change as W, because reciprocal of M is your W pattern. So W pattern QRS you will see in B5, B6. I am going a bit deeper, try to understand. M pattern in lead 1, V1, and a W pattern in opposite lead B5, B6. If you see such pattern, it is your right bundle branch block, because what I mentioned previously is your in bundle branch block you will see M pattern in lead 1, V1. Why lead 1, V1? Because it is a right bundle branch block, and also you will see a reciprocal change in your opposite leads. So reciprocal of M is a W pattern and B5, B6, right? So now you understand, and the opposite is true for the left bundle branch block, right? Now let's move here. See, so just focus here, right bundle branch block, there's a wide S wave anyway, and see this is your M pattern, okay? This they mentioned R and R dash. So M pattern in lead 1, V1 makes it your right bundle branch block, and in B5, B6 you may see W pattern. So this is about your right bundle branch block. In your left bundle branch block, it will be more preferential to see B5, B6, B4, this type of leads. So there you can see M pattern and W pattern or any other changes in your opposite leads, okay? So I hope now bundle branch block will be clear for you, right?